Hi everyone, this is chat number 5 in the series Straight Talk about Old Age. The title of this chat is Pain. Here are some of the key points. Pain is inevitable. Suffering is an option. Chronic pain and daily pleasure must be balanced for well-being. The ability to bear pain is always changing. And finally, other people can tell when you are in pain, even if you are unable to tell them. There are many different kinds of pain: inflammatory, neuropathic, cancer pain, and so on. About half of the older people in the community and 80% of long-term care facility residents have chronic pain, and this requires a pain management regime. Let's explore the fears of pain. Some of the fears revolve around not being able to communicate, to tell someone when you are in pain. Another is about the humiliation of emotional breakdown associated with pain that goes unrelieved. Another fear is about addiction, another about tolerance, dependence, and side effects of pain medication. The truth is that most pain can be managed, reduced to a tolerable level at least, but it is unrealistic to expect a totally pain-free life. Figuring out how to manage pain is very tricky. Pain medication cannot be used in elders the same way it is used in younger people. We are still learning how drugs are used and eliminated in older bodies. The mainstay for pain is still opioids, narcotics. We are still learning a lot about this, such as how to use morphine most effectively. It is an evolving science. Chronic pain that does not become tolerable with medication may eventually have to be alleviated through surgical means. These procedures, these surgeries work by decompressing nerves, blocking pain signals, stimulating nerves that help to block pain, or actually severing, killing the nerves through heat, radiation, or cutting. Today, many of the procedures involve implants of devices that send out signals to the nervous system. Assessing pain is a major concern for doctors and nurses who work with people, especially those who cannot communicate. This includes people getting out of surgery, those who have had a stroke and can't talk, and those who are on ventilators. Carefully designed pain assessment tools are commonly used in hospitals to tell if patients have pain and how well the pain medication is working. I mentioned the pain-pleasure balance in the beginning of this, and it is my strong belief that the more pain in a person's life, the more there is a need for pleasure. It constantly has to be balanced. So those people who have chronic pain need to have interspersed throughout their days moments of pleasure. Perhaps every hour or two, something to look forward to that resets the person. I also want to add a note about caregivers and loved ones. Sometimes an older person's pain is much worse when they're around certain people who can't handle seeing them suffer. The sense of powerlessness puts so much stress in the air that older person's pain increases. When a caregiver or loved one can comfort the older person in pain, it helps everyone. It relieves the sense of powerlessness and reduces the pain.